Hello, everyone. I'm really happy you made it to this webinar and glad to meet you. My name is Alexandra Stulova. I'm a business development representative and project manager of the DTEAM company. And today we're going to talk about insights of EHR and EMR systems for healthcare industry. We're going to talk about what exactly those two systems are, and also I'll walk you through some points, advantages and disadvantages of those systems. So let's take a look at content of our webinar. So first and foremost, we're gonna get acquainted. Please write down in the chat here, where are you from, what your company does, and what exactly, why did you come to this webinar, and what's your point of getting to know those two systems. So we're going to talk about a bit who we are and why we have this expertise to give you on these systems. The second, what is EHR system? Why do you need it? Advantages, disadvantages of this system, and example. The next point, we're going to look at an example of the system, and also EMR system. In some cases, those two are used interchangeably, but we will get through all the differences between them. And the same, I'll explain why you need it, why it can benefit your business, and so on and so forth. Example of such system, and more precisely, we will talk about differences. And then if you have questions, we will discuss everything. So first, let me introduce our company and why we actually decided to create such a webinar. Our company is a software consulting company. We develop and upgrade corporate information system in a variety of domains, from healthcare to recruiting, energy law, CRM system, everything you can imagine, actually. It's not an advertisement, it's just the point I'm talking about is to let you understand why we have this expertise and why we can give you some valuable information you need to know once you want to implement such systems in your company. So now let me show a bit things we have created ourselves. Unfortunately, I cannot talk precisely about EHR system we are developing right now because of NDA policies, but I can walk you through some projects we had. So it's like Optim Care. This is really similar to what we're going to talk today about. It's service provider platform which covers healthcare and other kinds of care you can have in your life. So the point was to develop a platform for services to performance and customers in their city and district. And we made it perfectly well. As you can see, it's a beautiful, user-friendly website with a lot of functionality and also a mobile version. So that's it. So it's a quick discourse into what we have already done. And now let's take a look at actually the point of our meeting. So what is EHR systems? For those of you who know, it's great that you know it, but still I need to walk you through all the main things. EHR stands for Electronic Health Record. It's a digital version of a patient medical record that is stored and managed electronically. It contains all the patient's health information: medical history, medications, allergies, immunization records, laboratory test results, the prescription, and much more. Why do you actually need it? So once you have business in healthcare industry, you are wondering how to increase your profit, how to make things go smoothly, and as a result, to boost all processes in your business. So this system, as well as EMR system, sometimes I will talk about both of them because there are certain things that are same for both. Sometimes I will separate. Okay? So EHR systems are designed to improve the quality and safety of patient care by providing healthcare professionals with accurate and up-to-date information about patients' health. They also make it easier to healthcare providers to share information with each other, coordinate care across different settings, hospitals, clinics, doctors' offices, laboratories, and other healthcare institutions. So what are advantages of such system? So first, as I mentioned before, it boosts all processes in your company, and 100% it improves efficiency a lot. First, by saving physicians time at each patient visit. So like here, like having those information just said is not that persuasive, right? So we need to have some numbers to understand the how valuable it might be. So also the time savings on a per visit basis may be relatively small in a discourse of one visit. But for example, if the time spent with each patient drops from 20 minutes to 18 minutes, you can most likely see 2 more patients every single day. And even this small, it might seem a drop in the ocean, you might think, but actually it's an extra 100 per patient, which is $50,000 by the end of the year of increase of your sales. So I think it's pretty persuasive and something that can be, a good point of implementing such a system. We have different types of HR systems, and let's talk a bit more precisely about each of them. So the first one is physician-hosted HR system. This system stores medical data on servers within the facility, requiring the purchase of data storage hardware and information security measures. This option is best for larger practices due to expensive. It's pretty expensive, to be honest. So big chains of hospitals, other healthcare institutions might have this. The second is remotely hosted HR systems, or it serves outside the practice. So this option is beneficial for smaller practices unable to afford physician-hosted solutions. The next one is subsidiarized remote HR systems, which pay another medical practice for access to its HR. It's also an option, but it results in minimal, the good option is that it results in minimal HR management costs, but at the same time, data ownership issues might arise, so like it's pretty controversial type. And to my humble opinion, the best one is cloud-based HR systems. Those are systems which store data in the cloud, providing enhanced data security through the EHR vendor's platform and revealing healthcare IT concerns. This option is super popular due to the lower upfront cost and the lack of need for an IT professional on staff to manage on-premises servers. So this option is the best one, like for those who don't want to spend all money in the world on the system and at the same time have secure and functional HR system. Now we are going to talk about must-have features of such a system. So the first one is patient portal or profile. This is first and foremost, to have a good result, you need to first please your customers, your patients. They need to feel that everything which is done was done for them and only them. So now let's see, just give me a second, please. I will talk a bit more about this one. So yeah, a patient portal can be a separate app on patients' phones, let's say, or a healthcare system that could be inside. So which means patients will access those systems on their desktops. To use such a feature, patients need to get some documents such as an activation code, or it might be instructions from their healthcare provider. EHR patient portals provide different means for patients to do different stuff. For instance, access personal health data published there by a healthcare facility, schedule in-person or virtual doctor's appointments, cancel, reschedule them as well, view past appointments, as well as you, as I mentioned, reschedule, cancel future ones, download and complete registration forms, view diagnostic test results, update contact and other personal information, and receive notifications when new information is available. It could be test results, prescriptions, bills, medical documents, whatever. And it makes it super convenient for patients to stick to the hospital or, you know, the place where they have the system, because it relieves a lot of stress out of it. So like this. Also, communication features. Those are chat with a doctor or other people who work in the industry. Also, it can be text messages, audio messages, video messages, so everything. The next one is e-prescription. This one is a really valuable one because that's actually the point why many healthcare companies decide to implement EHR system. Having handwritten e-prescriptions is no longer you know, a thing. It's an old-fashioned system, and in many cases, patients get sick of handwritten prescriptions and the rest of the stuff. So e-prescription is a solution for that. Usually, as I mentioned, patients receive a handwritten prescription from their doctor during face-to-face appointment. But this option, e-prescribing, has advantages over handwritten because it includes request prescription refills easily and checking for potential drug interactions. E-prescribing also helps to prevent incorrect dosage amounts, and patients can clarify prescriber instructions or report side effects as needed. So it's super beneficial feature. The next one is charting and documentation management, such as medical history and appointments monitoring, as was mentioned in patient portal or profile. Electronic prescription management as well, safe storing of test results and medical images, data exchange with other modules, and customizable specialty-specific EHR templates. So as you can see, those features are interrelated, all of them. So if we have prescriptions, the way we use it will be represented in charting and documentation management module. Also, we have lab integration, billing, and cloud computing. Let's talk a little bit more about lab integration, which is also an interesting feature to implement in the system. A lab information system can be as well as profile. It can be a separate program or an app, or it can be inside of an EHR system. Either way, it helps healthcare providers track and receive test results easily and fast and here and now. It can also help medical labs address common issues such as human errors, slow turnaround times, and inventory availability. It also improves patients' awareness about their health and allows labs to improve their internal process. It benefits everyone. And cloud computing, which I mentioned actually when I was talking about types of EHR system, but let me say a few more words about it. As a method, this cloud computing is a method of storing electronic health records either locally or remotely. And those systems with cloud computing features are becoming increasingly popular. And there are several reasons for that. They reduce management effort. also a lower upfront hardware and software costs, and also reduce maintenance costs. So still everything goes down to saving your money and boosting your business. All right, so here we have a list of such systems. I will send you after the webinar emails with a recording of today's meeting, and as well I'll attach some videos on how it actually works. On the example of Kyria Clinical, this is HR system, and there are videos of how it actually works with a patient profile, with prescribing, and all of the features we talked about. The next one would be EMR system. So, as I mentioned, many people who work in healthcare can use those two terms, HR and EMR system, interchangeably. But it's not always true, because there are some differences we should know about. So first, let's start off with definition of the system. Electronic EMR is an electronic medical record system, which is similar, as I told you before, to EHR system. Why do companies need it? Still the same reasons, actually, just a little bit. There are some differences in creating and in functionality of those two systems, but reasons are the same. You needed to boost your business. You needed to minimize costs. You need to have it to optimize all processes in your company. So everything. As well, we have here examples. And as you can see, we have it even created specifically for different needs. Some of them were created for medical billing. Some of them were created for small practices. Some of them were created for large ones, for telehealth, for even separately mental health practices. So before we get started with the differences, I just want to point out that when it comes to creating an EHR system or EMR system for your company, it all depends on which processes you want to simplify and you want to optimize. That's the main reason the main point when it comes to choosing which one to use and what features you want to have there, because the variety of functionality in those systems is incredible. So, and it can be designed specifically for someone's business. All right, so differences between EHR and EMR systems. Eventually, I have mentioned several times that those two systems are really similar, and sometimes it's pretty difficult to understand where we have EHR, where we have EMR system. So let's take a look. First difference is that EHR is a digital record of patient health information, and EMR a digital version of a chart, which means you just add information in EMR system. It is not possible to predict something, to have some, data on the progress of someone's some patient's health and so on. The next one is streamlined sharing with other providers and labs, etc., or updated real-time information. An EMR system does not have such a thing. It's not designed to be shared outside individual practice. Simply putting it simply, EHR is a larger system where you can interact with other healthcare institutions and exchange information. EMR is mostly for practices inside companies, so it's not possible. It's not designed to share with someone else, with some other institutions. HR system allows patients' medical information to move with them. An EMR system, in the system, patient record does not easily travel outside the practice. Still, if you need to share information with other institutions such as labs or some diagnosis centers or other doctors from outside your hospital, it's better to do with HR system. If you want to, if you know that this information is not going to go any further but in your own company, then EMR system is better. And still, in both cases, can be different approaches. It can change, of course. It can be redesigned. It can be done in different ways. So it all goes down to your personal needs. And the last difference is that HR system has access to tools that providers can use for decision making. What it means, it enables you to have, like, I'll give you just a case. When you have, for example, health story of someone, medical story of some patient, and the HR system gives you points on what could be further according to what had been before. So if I could put it simply, but still. And EMR system mainly used by providers for diagnosis and treatment. So it's not a good system for decision making. Having said that, all the features, all the differences I mentioned can be not differences after all. I mean that each system can be designed in a specific way, and it can be even a mix of features from HR and EMR system because they are really alike. So if, for example, you have a small hospital, you need to track appointments of your patients. You need to have a special app for your patients to easily arrange an appointment, cancel, reschedule, whatever. So some basic functionality. It can be created, it can be realized in EMR system. If you need something bigger, something massive and more complicated, EHR system is a better option. So still, everything comes down to your needs. So I think that's the main information I wanted to highlight today, and I'll send you the websites of those services, best EMR and EHR systems of 2023. You can take a look at the functionality there, and remember that this functionality can be extended, it can be vice versa, so like this. Thank you a lot for attention. So if you have any questions, I'm waiting and we can discuss them. Thank you once again that you made it to the webinar, and I hope it was valuable information, and now you know at least the main functionality of the systems and differences between the two and how to choose them. So thank you once again for coming, and I hope to see you the next webinar.